Good.
Have you ever left a dental appointment confused on treatment you need or wondering the reason behind this dental work? You are not alone if you've ever felt this way. I have worked in the dentist industry for over 2 years and spend a lot of my days explaining to patients why we are doing what is proposed on them, because often as normal human beings, we usually don't fix things until they're hurt or broken, right? This is what your dentist should be your best friend, because they're solving the problem before you're even aware that they are there. Dentistry is very unique, as no two mouths are the same. Different treatment options are made depending on each individual's health, oral hygiene, the situation at hand, and the patient's decision. Dentistry plays an important part in an individual's oral hygiene, and affects overall health. Understanding what to expect at a dental visit will ease dental anxiety and help to get an idea on how an appointment will go. It's recommended to have a routine dental cleaning done every 6 months. Dental cleanings involve the removal of plaque and dental plaque from teeth and root surfaces with the intention of preventing cavities, gingivitis, and periodontal disease. They also remove stains on the teeth that could eventually lead to dental decay. Removing the stains makes the patient smile wider and brighter too. Having routine dental cleanings is a huge part in preventing gum disease, which is the main reason for early tooth loss. A lot of people are not aware of this, but there's a strong link that exists between cardiovascular disease and gum disease. Getting these cleanings done routinely every 6 months can potentially save a patient from a deadly heart attack or a stroke. Because of this link and dental work, generally the dentist will prescribe a pre-medication antibiotic to any patient who has had surgery in the last 7 years. This prevents the bacteria that is in the oral cavity from getting into the bloodstream. X-rays are generally taken at every other cleaning 2 or once a year. These are very low radiation X-rays, and they help to see in between the teeth for decay and monitor bone levels. At the cleaning, the hygienist will also go over steps with oral hygiene habits with you. They make sure that you're getting enough fluoride in your diet. You only need a certain amount of fluoride in your diet to keep your teeth strong and prevent against tooth decay. On the other hand, too much can result in fluorosis, which is permanent discoloration on the teeth. The best way to get fluoride is to drink water that is fluoridated or take supplements by a doctor. The hygienist will go over the proper way to floss too with you, which is a C-wrap shape between each tooth. They also discuss what kind of toothbrush you're using, and the best toothbrush on the market is actually an electric toothbrush because it helps with recession with the gums. Along with getting dental cleanings, dental offices also are busy doing operative work on patients that are in need of it. The most common procedures that are done are filling cavities, placing crowns, doing root canals, and removing teeth. Cavities are the most common problem that is dealt with in the dental world. According to the American Dental Association, nearly 90% of children have at least one cavity before adolescence. Cavities are due to the breakdown and demineralization of enamel. This can happen in a very acidic environment in the mouth or from sugar. Plaque buildup and not having regular cleanings can also enhance this increase of getting a cavity. Most cavities cavitate in between the teeth because people do not floss regularly. Teeth that are in the short term, that causes cavities. In the long term, cavities can lead to pain and also infection if not treated. Teeth that are infected have to have a root canal and crown placed or removal of that tooth. Getting the proper amount of fluoride in your diet, brushing 2 times a day, and flossing once a day will help prevent cavities. Crown placement on teeth is necessary if a tooth has a large filling in it or is severely broken down. In order to place a crown, the dentist has to take about 1.5 millimeters circumferentially around the tooth to be able to place a crown on top of that tooth. After fabrication in the dental lab, these personalized crowns are cemented on your tooth structure and last many years. A root canal is necessary when a patient is feeling pain due to a dental abscess. It consists of going inside the tooth that is in pain and removing the nerve in the tooth with a series of files. In doing this, the patient is able to keep their tooth. On the opposite side of this is dental extractions, and these happen when a patient is in pain and do not want to save the tooth. Removal of wisdom teeth are very common dental extractions, but are usually performed by an oral surgeon. Although a majority of the dental work is done in your routine dental office, there are certain scenarios where referral to a specialist may be necessary. Much of the general public is unfamiliar with all these different kinds of dentists, but they include General dentists, pediatric dentists who work on children, periodontists who deal with gum disease, orthodontists who specialize in movement of the teeth through braces or Invisalign, endodontists who specialize in performing root canals, and oral surgeons who remove teeth and place dental implants. In order to visit any of these specialists, you will first need to visit your general dentist and get an examination performed. Most general dentists perform some specialty dentistry in their office if they're simple cases. Most dentists know that they need to refer something out before they get into the procedure by examining clinically or viewing an x-ray. I could go on for days about all things dental, but I hope you learned something today that you can take with you next time you go to your dental visits. It may seem a little arbitrary for me to talk about a subject as dentistry, but often we have a lot of patients that come in after many years without dental care and need quite a bit of work done. This ends up being a surprise to the patient because they're both uneducated about dentistry and nothing has caused them pain to make them come in. Dentistry plays an important part in your oral hygiene and affects your overall health, so being educated on why dental visits are so important will also often push a patient to keep up with their dental work. Learning the general ideas of dentistry will also make you more understanding of what might happen when you come in for your dental visits.